In this presentation, we will be comparing Lyme disease in the U.S. and Lyme-Like disease in Brazil and discussing the public health significance associated with them.
We hope to answer the question that among vulnerable populations living in Brazil, do healthcare professionals' attitudes and overall prevention efforts concerning Lyme-Like disease differ in comparison to those among vulnerable populations living in the U.S. in the 21st century?
Lyme disease is an endemic disease that the CDC holds records on since 1996. While this disease is most commonly caused by the Borrelia burgdorferi bacterium, it can be found in many different ticks and animal reservoirs. Although the most characteristic symptom is a rash, without this symptom, diagnosis can be very difficult for this disease. Other symptoms can range from flu characteristics, arthritis, or even psychological effects.
In Brazil, Borrelia burgdorferi bacterium has not been able to be identified in Brazil and is widely accepted that the ticks carrying this bacterium do not live in Brazil. Though similar cases of patients producing symptoms that of Lyme's disease that is seen in America, it has been later identified that it's actually a Baggio-Yoshinari syndrome. It is important to make this distinction as it translates to an accurate health diagnosis.
In 2018, the prevalence of Lyme disease totaled 33,666 confirmed and probable cases in the United States. The most at-risk group in the U.S. tends to be outdoor workers, but specifically those workers in the Northeast and Mid-Atlantic regions. The time we see the highest risk of tick-borne diseases tends to be in the spring and summer seasons.
Prevalence data of Lyme-Like disease in Brazil is lacking due to the fact that most cases occur in rural areas that have limited disease monitoring capabilities. Those in the vulnerable populations are people who are frequently in contact with the Lyme-Like disease reservoir, tick-carrying animals like capybaras. Factors that are contributing to the spread of the disease in both countries are climate change effects, outdoor activities, and industries that profit off wooded areas.
It is hard to focus on the public health significance of Lyme-Like disease in Brazil, as most cases happen in rural and coastal areas where data is scarcely collected. Exposure can vary as they have found many different types of animals containing spirochete in the blood of rodents, marsupials, and larger animals. This makes vets, botanists, and hikers in the higher risk range. In the United States, there is more emphasis on Lyme's disease, which there has only been one death directly associated with Lyme's disease, but costs the system $1.3 billion to treat. There is currently no FDA approval vaccination for Lyme's disease. However, researchers emphasize the importance of creating hybrid vaccines that target both the vector and disease along with the agent itself.
As the United States, compared to Brazil, is more proficient in the diagnosis of Lyme and Lyme-like diseases, the high-income country is also better capable of raising public awareness of the condition and its crippling health effects. Specifically, this awareness arises from implementation of national social awareness campaigns in addition to celebrity advocacy. Organizations like the Global Lyme Alliance and LymeDisease.org are notable platforms that utilize social media to educate the public on the importance of getting screened for Lyme disease and to forge advances in research. Further, celebrity advocates, such as those pictured, are beneficial in humanizing the disease and promoting favorable health outcomes along the way. Conversely, the same degree of awareness for Lyme-like disease in Brazil is unfortunately absent. This discrepancy may be linked to underdiagnosis, which deceives the public into assuming that the disease is much less prevalent than it is. Additionally, and as with many diseases in Brazil, patient alliance and empowerment is less profound in the media in comparison to the United States. While this may be consequential to the American obsession over publicity in the mainstream media, the diminished social support from Lyme-like disease in Brazil may contribute to poor patient morale and subsequent unfavorable health outcomes. So why is the lack of social awareness and support so important? According to a case report in the Brazilian Journal of Infectious Diseases published in 2012, Lyme-like disease is significantly underdiagnosed in Brazil. Because of this, healthcare professionals are generally unfamiliar with the disease's clinical presentation and prevalence. Therefore, there persists a nasty cycle of underdiagnosis that leads to further misconceptions of the disease, contributing to absence of clinical care and unnecessary disease progression.
The ticks that carry the bacteria that causes Lyme and Lyme-like diseases are the most prevalent in the ecosystem during the months of May through July. One of the most effective ways in controlling the tick population is controlling the tick host population. This can be done by passing policies on hunting or culling the tick host during these months. Another possible prevention effort are awareness campaigns for those peak months that warn vulnerable people to take the proper precautions against ticks.
In comparison, Lyme disease and Lyme-like disease in Brazil share similar symptoms in populations, but there is a difference of focus on the diseases. There are many awareness campaigns within the U.S., but in Brazil, there seems to be a lack of awareness and understanding of Lyme-like disease that leads to a different healthcare experience and even improper diagnosis. Healthy People 2020 shares a goal of improving society's quality of life, but ultimately, wrong diagnosis of any disease can negatively impact the spread of disease, lead to other illnesses later in life, and more unnecessary patient dollars spent. Do these results sound like a promotion of well-being and quality of life to you?